Hello. Recently, I thought I'd better do some reading up about the new medical guidelines. So I bought myself a great big book, and one lunchtime I got this book out, and I opened it up, and I fell asleep with my face on it. I only woke up just in time for evening surgery. Well, my first patient that evening was a man called Mr. Fapso, and as it turned out, his blood pressure was sky high. So I said to him, I think it's time we had some tablets for this blood pressure of yours, Mr. Fapso. And he said, "There's nothing wrong with me blood pressure, Doc. I've got that water coat hypertension, haven't I? You need to fit me up with one of them ambulatory blood pressure monitors." I said, well, I hadn't got an ambulatory blood pressure monitor. As a matter of fact, I'd never heard of one. "Yeah, well, refer me up to the hospital. They can fit me up with one there." I said, now look here, Mr. Fapso, we can't just refer people to the hospital willy-nilly just because it takes their fancy. The NHS is strapped for cash, you know. "Oh, yeah, well, that's typical, that is. You don't mind telling me off, but any time I want a bit of practical help, it's, oh, no, we can't afford it. We're strapped for cash, we are." And he started poking me with his finger. And I suddenly thought, well, this is what being a GP's really all about. I mean, it is about medical guidelines and all that, but it's also about people arguing with you when you try to tell them something and poking you with their fingers. Somebody ought to write a book about that. So that's what I tried to do. And if everybody would kindly go out and buy a copy, then I might get enough money to buy an ambulatory blood pressure monitor, and Mr. Fapso might stop poking me with his finger. Thank you.